here's the thing. I think the best thing you can ever give somebody is to empower them with tools to create the change themselves. These are tools that you can take away for a lifetime. It's not something that you do once, though. Like, I think we need to understand that, this is a constant. As long as you're alive, you can be feeding input back to your nervous system. And what a beautiful thing that you can do that yourself, that you can heal yourself, that you can regulate yourself.
Welcome back to the podcast, everybody. This is episode 146. My guests today are doctors Monique Andrews and Tamara MacIntyre. They are both chiropractors. They are a powerhouse dynamic duo who I first heard about through my training with BIRTHFIT to become a BIRTHFIT leader and coach. And Dr. Mo was you gave a webinar there, and I was like, this is incredible. Like, I had heard a lot about polyvagal theory, but the practical applications to what we do in women's health, I think, is just so understated, underappreciated. So I feel like this type of complex framework around the human nervous system is really where it's at. I think this is going to take us a huge leap forward. Of course, they're drawing from the work of Stephen Porges of the Polyvagal Institute, but these two women have such a gift for simplifying some of these otherwise very, very hard things into basic exercises and basic sort of models for understanding how the nervous system impacts your immune health, how it impacts the development of your baby, co-regulation between mother and the baby and father and the baby and father and the mother. This is really, really important work. You're going to love this interview. If you want to learn more about Dr. Mo and Dr. Mac's work, go to the pranafoundation.org. That's pranafound.org, and their new program, which is really a platform for mindfulness and embodiment exercises. That is Cōpe, letscope.org. You're going to love their work. I recommend going and just buying all of their programs. It's a couple $100 per program. It is the best, $1,200 that you're ever going to spend. I promise you that. I've done almost all of them. I didn't realize that there was a couple extra that had been hiding from me, but I am very, very stoked for you to hear this interview. This podcast is an effort to provide public-facing free education on a variety of topics that pertain to women's health, the health of families, health of children, embodying, beautiful births, etc. So I hope you find something valuable here. If anything pings your interest in this episode, please share these episodes with your friend. Leave a 5-star review if you haven't already on Apple Podcasts, Spotify, wherever you get your podcasts. It really means a lot, actually. Rising in the ratings, getting more of these conversations to the people that need to hear them. It's completely free to support us in those ways. And if you haven't checked out the YouTube channel, go there. It's the Holistic OBGYN podcast on YouTube. You can see Drs. Mo and Mac in the flesh, as well as every other guest, all the amazing guests that I managed to wrangle up for this, for my little podcast over here. Of course, we do always have a couple sponsors. I'm going to be moving towards a relatively sponsor-free podcast in the very near future. In fact, by the time you hear this, there may only be one or two or just one sponsor. And that sponsor that is definitely sticking around is the one who in part made this episode possible. That's Intel AHCC. This is a whole food supplement that has been well studied in rodent and in human trials in order to support people with liver disease, renal disease, autoimmune conditions, treatment-resistant epilepsy, and of course, persistent HPV. They've done in vivo trials that have shown that women who have been unable to clear HPV have taken this for 4 to 6 months, and they're seeing a massive change in their immune health and their ability to clear the HPV, show up at their next OBGYN clinic, and be completely worry-free about persistent HPV leading to cervical dysplasia, and ultimately, if nothing is done in the meantime, to cervical cancer. So the way that these supplements work is, well, first off, they're made from the mycelia of shiitake mushrooms, and they boost your NK and T cells. They boost the interconnectivity amongst your entire immune system in order for you to better integrate the message of viruses and to kick precancerous or even early cancer cells to the curb. I love this product. That's why I'm keeping them on as a sponsor. There's so little conversation around what can be done to support your immune system, so much so that if you get a persistent, let's say you get an HPV screen that's positive or an abnormal pap smear, your doctor says nothing more but, hey, come back in 6 to 12 months and we'll repeat it. And if something's wrong, then we'll talk about that when you get there. Well, what are you supposed to do in the meantime? You can work on your diet, your lifestyle, your movement, your sleep, your stress management, your hydration, your breathing. All of those things are relevant. In some directed supplementation with a product like Intel AHCC is doing wonders for my clients, and the co-creator of a new program I've got coming out this month. In fact, the doors open in a couple days, called Clear and Free, your holistic solution to persistent HPV. If you want to learn more about that, go to clearhpv.com. You'll find the program there. You can join in on the next cohort. We talk a lot about immune intel, but also a lot of the other lifestyle factors, as well as demystifying cervical cancer screening, this whole virus HPV thing in the first place, the immune system, vaccines, etc. It's all there. So go check out clearhpv.com. All right. Thank you, Immune Intel, for continuing to support the show. Of course, there's a variety of other products out there that can help you improve your health, including Organifi, BIRTHFIT, Bioptimizers, WeNatal as a prenatal vitamin. All of these are really, really helpful adjuvants, and there's nothing quite like Immune Intel for those of you who are struggling with autoimmune conditions, nervous system disorders, or persistent HPV. So clearhpv.com, and go support Immune Intel AHCC if you use code beloved10 at themedicine.com. That's THEMEDICIN.com. You'll get 10% off your purchase. And when you enroll in at clearhpv.com into our new Clear and Free program, you get your first bottle free. So go and do those things. In the meantime, here's my lovely conversation with Dr. Monique Andrews and Dr. Tamara MacIntyre of pranafound.org and letscope.org. Enjoy, guys. Here we are. All right, doctors Monique Andrews and Dr. Tamara MacIntyre, welcome. Welcome. It's good to see you.
Thanks, Nathan. Excited to be here. We'll try not to talk over each other.
Yeah, well, it's just a part of the nature of the beast here. You guys are in your home at the same property, but in different rooms, and there's three very, very chatty Kathys here. So if we talk over one another a little bit, that's okay. Guys, I found your work through BIRTHFIT. Actually, I heard Dr. Mo, I heard you gave a talk on polyvagal, and I was like, I got to get more into this, because I've thought of the nervous system as two separate components. There's a brake pedal and there's an accelerator, and that framework hasn't really served me well. But then I went to your website, which is pranafound.org. If anybody out there is curious, these courses are so well worth your time. They're short, they're sweet, and they're right to the point. You started talking about like the in utero development of the autonomic nervous system, and my head just about fell off. Because it's something that we think about as OBGYNs, but now you're giving me some practical applications of some of this as well. So why don't we start first with this polyvagal theory? People were talking about this. Stephen Porges kind of set the groundwork, I think, at least in North America. Can you guys talk a little bit about what, first off, you guys are both chiropractors as well, right? Mm-hmm. So you have a clinician sort of view here. This is not just all theoretical mechanisms and whatnot. This is stuff you actually put into practice. So maybe why don't you start, Dr. Mac? I'm just picking, randomly here. Tell us a little bit about, this polyvagal theory and how it may contrast with this very, very maybe oversimplistic view of the nervous system of a gas pedal and a brake pedal.
Yeah, it's interesting because there's a lot of misconceptions associated with the autonomic nervous system. And so, the more common explanation is that there's essentially two parts, and that it's exactly that. It's either on or off. And the reality is that's not actually what we know to be the case anymore. And so it's not just about an on or off. There's actually a sequential way with which our nervous system works. And it's a really beautiful synergy. And so, historically, and you still see it, it's all over social media, where there's this conversation associated with, we're going to bring people into the parasympathetic. It's called polyvagal for a reason, because it actually has two parts. It's not just the sympathetic, or, it's not that classic kind of rest and digest, or you're running from the tiger. And so what's really important for people to understand is that there are newer branches that we now know and understand, and that it's really, really important to understand, especially as a clinician, what that means for your patients, to be at, how people are responding in the world is actually a byproduct of their nervous system. And it's a byproduct of their experience. And so ultimately, the autonomic nervous system is really a hypersensitive system, and it records our experiences, and that becomes the way our nervous system actually engages in the world. That's the polyvagal part that a lot of people are experiencing but not understanding, because of the oversimplistic way we've historically talked about our nervous systems.
Dr. Mo, autonomic ladder. Can you just describe that? And then maybe we'll throw it back to you, Dr. Mac. I'm doing my best here to moderate two very intelligent people being in the room together. So you'll have to bear with me, guys. So this polyvagal theory leads us to these illustrations that you see all over the internet, the autonomic ladder. Maybe you can describe this, Dr. Mo, and then Dr. Mac, why don't we throw it back to you, and you can use, from your clinical insights, how can you identify as a clinician, or even as just an individual listening, where you might fall in that ladder, given your certain, your specific life circumstances, past history, past traumas, perhaps?
Yeah. So the autonomic nervous system, essentially from an evolutionary perspective, develops through these different branches, or what Porges called neural platforms. And so we have the sympathetic, everybody knows, is the fight or flight. And then the vagus, of course, splits, hence the name polyvagal. And within that, we have ventral vagal and dorsal vagal. And so we have these three phylogenetically organized platforms. They call it a ladder because at the top of the platform, if you search polyvagal theory, you're going to get a picture of these three funny little dudes that are red, green, and yellow. And the green guy is at the top of the ladder. That's like I'm the king of the world, queen of the world, super connected, high parasympathetic tone. And this is where healing happens. This is you feel love and connected to the rest of the world state. This is where people think, oh, if we could just be here all the time. Of course we can't. We're dynamic systems. Let's say you're in an environment and your brain at all times is surveilling, and what it's looking for is safety. Safety is our most important human need. So the brain is always looking, is the environment safe or not? If it's safe, everything's great. You're the queen of the world. You're green, ventral vagal. If you're not, then if there's a threat, what your brain does is immediately drops out of the prefrontal cortex down into the amygdala, and you go into fight or flight. This is a normal evolutionary response. You want this to happen, right? What you don't want to happen is to get stuck there, which is what happens a lot right now, is that people are getting stuck in this loop of fight or flight. Now, let's say that the threat goes beyond just a sense of difficulty or danger, but drops deep into life threat. That's when you see people drop into what's called the dorsal vagal. That's the red zone. That's the freeze or fawn response, right? Yeah. So top of the ladder, that is freedom, friends, and forage. Sympathetic is fight or flight. And then dorsal is freeze or fawn. And what Dr. Mac can tell you about is how, as a clinician, you can actually learn to identify those different stages and then be very prescriptive in how you help people get out of them.
Yeah. So Dr. Mac, let's throw it back to you. But before we do, I think it's important to consider that we're not just talking about being out in the savannah and being chased by a lion. We're actually talking about every one of our life circumstances, from the color of our skin to how we identify sexually, through sexual orientation, through even like the interactions that we have on a regular basis because of some deformity or something that makes us feel unseen or maybe not beautiful in the world, that these can lead us along this ladder, such that we might even end up with health consequences as a result of a person living more or less in the dorsal vagal. This is what chronic stress, I think, maybe kind of brings, up in our clinical practices. So, from an OBGYN standpoint, what I love to say is that, hey, if we can take some accountability for how we show up in the world. And so a lot of these tools that we're going to talk about today are very much accessible to us. But at the same time, we have to consider systemic change so that we have a more inclusive, less divisive society. And right now, post-COVID, I don't really feel like there's much safety anywhere. Everybody kind of wants you to feel unsafe about things. So Dr. Mac, you're up to plate here. How do we, I think most of us know when we're in ventral vagal, like that's when you're having the best sex, you're most connected with your partner, you and your kids are just jiving and flowing, but that's not where most of us live. So maybe you can help people identify a little bit from a clinician's lens. How do you really identify this before we start applying maybe some principles in order to help balance our nervous system out?
Sure. What I would say to you is what you just described is we all know what connection feels like, or we know when we can make, when we feel safe. I mean, one of the things I hear a lot right now is people saying that they create safety, they create a safe space. And the reality is you can hold a space, but everybody's going to enter and it may or may not feel safe based on their previous experience. And so, my course correct for people is you're not creating the safety. We are responsible for creating our own safety, and how we feel in an environment is a byproduct of how we have felt and are feeling and how we're presenting. And so, when you say that we all know what that feels like.
Let me add to that. You or Dr. Mo had said this in one of your programs. I've done all of your programs now because I'm obsessed with you guys. But real quickly, I think it was maybe Porges or it was one of you guys that had said, you're not responsible for your physiology, but you are responsible for the circumstances that sort of unfold as a response to that physiology. Would you want to maybe refine that a little bit, and then of course dive in, of course, to how we can identify where we're falling on this ladder?
Yeah. I mean, that's you, Monique. You say that all the time.
Yeah, I always say that your biology is not your fault, but it is your responsibility. And, the beautiful thing about that ladder I was just describing is all of those platforms are available to all of us at all times, but we do tend to get stuck in them.
Yeah.
And understanding that from a clinician's perspective, I think what that really does is it allows us to be much more compassionate. We've all had that hyper vigilant patient come into our office where they're just a million questions and objecting, and they just can't be cool. They can't be calm. And that's
cool.
It's just like, it's going to be all right. And that's not enough to say it's going to be okay. Because when somebody's in that hyper vigilant fight or flight state, they feel unsafe.
Yeah.
And that really speaks to what Tamara was saying about, saying that you create a safe space. I'm glad you have that in mind. But, unless you give people the tools to feel more safe in their neurology, you just telling them it's a safe space, that doesn't mean anything.
Yeah.
What you described is, people knowing when they feel comfortable, knowing when they feel connected, knowing when they can accept love, where they trust, the environment that they're in. In the polyvagal theory, they refer to that as a glimpse. We all get that glimpse. And so, we saw, patients on our table where, at the end of the visit, or even just as part of the visit, is that big, deep sigh. Those are clinical signs that somebody is actually settling into a state of calm. But we can look at their body, how they're storing muscles, how they're posturing. We can look at their face. We can listen to the sound of their voice. We know that when somebody's really upset, the voice goes up, and we can use that as a clinical assessment. And so, are they able to hold eye contact when they're actually telling us about, their history or what they're feeling, or, what that actually looks like? How quickly are they moving? Are they slow moving? I sort of joke when I'm teaching chiropractors, it's like, well, how slowly do they get off the table?
Yeah.
How do they respond to your work? And so there are ways with which we can look at all of those things: eye contact, how their body and muscles, how do they respond to your touch? How do they, what does their facial expression look like? Are we actually able to read their emotions, or is it a flat affect and they tell us that they're really happy and their face hasn't been reminded,
From a really simple perspective, one easy way to figure out the platform somebody's in, or which of those states, are they mobilized? Mm-hmm. Right? Mm. That's a sympathetic. Now, if they're mobilized and happy, play, sex, art, dance, that's ventral vagal and sympathetic together. If they're mobilized and unhappy, that's sympathetic. And if they're immobilized and unhappy, that's a dorsal vagal. Now, there's another state, it's called a hybrid state, where you are immobilized and happy. That's called bliss. That's meditation. That's a cool experience. And most people, when they think about polyvagal, they see the red, the green, and the little blue dude, and that's it. But there are these hybrid blended states that we really dive deep into in our applied polyvagal class, so that you can give people the tools for a deeper understanding and to be able to drop into these other states.
It's also important. There's a concept that's referred to as a window of tolerance. And I think in general, we all kind of have an idea of like, my window of tolerance has gotten smaller in the last number of years, or life has created this smaller, sort of, and a window of tolerance is really our ability to self-regulate, our ability to feel calm in different environments. And so what happens, and when you really understand the platforms, then the ultimate goal becomes expanding that window of tolerance. It becomes that when there is a challenge, we talk about those individual states where you can be, aggressive and, defensive in your accommodation. And so that is actually one platform, is the individuals that when they're outside of their window of tolerance, they become hyper aroused, right?
Yeah.
And then there's the people who, when they're outside of their window of tolerance, or when there's the tipping point and the cup is overflowing, they go into shutdown. They become very passive, and that's a defensive accommodation as well. And I think when people understand, and even your ability to kind of, quickly assess, like what do you naturally do when you're threatened, when you are in an environment that's really uncomfortable, do you feel your physiology? Does it actually, elevate to such an extent that you feel uncomfortable? Or do you basically, or do you just sort of slip into the back of the room? Do you, not participate?
Yeah.
So
And
those
again,
are
I think
indicators.
it's really important to know that your tendency to be in these platforms is not conscious. All of this is happening below the level of consciousness. And so people get stuck, and then they're not compassionate with themselves for their behavior. But your neurology drives your behavior. Then that behavior starts to drive emotion. And then we're human, so we make up a story about it. And usually, very often that story involves blaming yourself for something. And these are just tools to help you understand that's not the way it works.
Yeah, I think, the crowd that's listening, many of them are also sort of aware that we take our nervous system for granted, but this takes time to develop, right? And then it fluctuates as we become adults, and we have all these stressors, adulting, that really impact how we're able to show up in the world. And I want to also, I try to hold compassion for my OBGYN colleagues, but most people working in hospitals are living in a state of either sympathetic or dorsal vagal. They're not really able to connect because they don't even feel safe themselves. They're worried about litigation. They're worried about the administrators and, how they're coding and all of this. It takes away from the work of being with a person and really being able to be sort of connected heart to heart. And if you don't feel safe, right, like you guys have said, you can't connect. So one really important topic for me, I've got 2 little girls of my own, has been the co-regulation between my wife and our daughters, and me and our daughters, but especially those moments after birth when a baby emerges earthside. And in the hospital system, we strip the baby away, we dry them off, we give them shots, we put them under these bright lights and masks and all this other stuff. It's probably very scary for them, when really what they most need is to be as close to their mother's heart as possible, feeling her breath, the motherese, these types of things. So of course, when a baby comes out, there's this evolving nervous system. But even inside the uterus, before there's what we would call like the motherese, the skin to skin and all of that, the baby's nervous system is developing. Can you talk a little bit about the development of this autonomic ladder? And then maybe we can even talk a little bit about heart rate variability, because we're using this in adults now, but we've used it. It's not very well validated, but we use heart rate variability a lot in monitoring a baby's distress levels. I mean, there it is right there. So let's talk about how these 3, simple platforms develop inside the uterus, and then the role of co-regulation afterwards in order to keep this baby alive. And
yes, there's quite a bit of science around it now, actually,
Yeah.
Nathan. And, the first thing to develop, of course, in the whole system is the nervous system. And that sort of drives the rest of the show. So around 4 to 6 weeks, the dorsal vagal system starts to develop. And then at around 14 weeks, then the sympathetics come on. And most people may or may not know this, but babies are born in a sympathetic dominant state. It's actually what drives a lot of growth is that they're
Yeah.
born in this sympathetic
Look at
dominant
their heart
state.
rate. 160
Yeah,
beats per minute is the upper rate of normal.
exactly.
Neighbor. So we're in sympathetic
Yep.
overdrive there.
And in fact, there's some data to suggest that babies who are born prematurely, if they are born before 30 weeks, which is the point when the sympathetic nervous system is fully developed, there's a risk of them dropping into bradycardia. Now, remember, dorsal vagal is immobilization. So we go into basic survival, and the heart rate can drop too low. And this is one of the theories around SIDS, actually. So
Yeah.
around
The
30
preterm
weeks,
babies
though,
are more likely to die. Sudden infant death syndrome is more likely to take place with preterm babies, not just because of lung development and everything, but also you're saying because their nervous system is actually not fully capable of managing itself out of the
yeah,
uterus. Is that right?
because
Yeah.
what's supposed to happen is dorsal develops first, then sympathetic comes on, and it's supposed to override dorsal.
Yeah. Yeah.
Yep.
Wow.
And if it doesn't, then we have a problem. Now, next is ventral vagal, that happy connected state where homeostasis creates healing and the thriving organism. That starts around 30 weeks and continues, this is really important, continues at a really high rate to myelinate, to fully mature the vagus nerve, the ventral part of the vagus nerve, to about 6 months, and then even into the first 2 years of life.
Wow.
So this is when the co-regulation becomes key. And it's actually those co-regulation behaviors that really help to promote the growth and evolution of that ventral vagal state. Now, people think that this is more of an emotional psychological thing, but what we now know from neuroscience is suckling, feeding, the contact between mom and baby or dad and baby, or skin to skin contact is really important. And we actually see there's an upregulation of oxytocin. Most people have heard of the hormone oxytocin, the
Totally,
love
yeah.
hormone or whatever. Well, we used to think that it required skin to skin. And while that will create the highest peak in oxytocin, actually, even just the sound of the mother's voice in particular. Now, so what happens when we have a mom whose nervous system is dysregulated, we're more likely to have a baby whose nervous system is dysregulated. Now, that's not to blame the mom, because what we said 5 minutes ago is your physiology is not your fault. But if you are dysregulated, you can create dysregulation for those around you. And we particularly see this in the mother-infant bonding. And we can now actually trace the neuroscience back to the vagus nerve, which is why this polyvagal thing is so critical. Because you see when there's a good emotional bond between mom and baby, you see high levels of not just oxytocin, but high vagal tone. We want that. When there is a poor bond that's usually created from a dysregulated nervous system, you actually see that you'll create a pro-inflammatory vagus signaling. You'll see excitotoxicity in the brain. This lowers vagal tone, lowers oxytocin, and then you don't get that thriving co-regulation, which Porges literally says co-regulation is a biological imperative. We need it. So when we have dysfunctional, disruptive, sometimes even violent birth situations where we don't have that time that's necessary, that's given, that's when we see a lot of disruption. I know that was a long answer, but
no, I want to add to that because I'm trying to find things to push back on, and I don't have a lot because you guys finally have given me language to really start to describe even the simple differences between a home birth environment and a hospital environment. Our second little girl, she was born at home on my wife's chest moments after the portal opened, the portal closed. It was like a 90-minute labor. It was like the dream birth. And she was on her chest moments after, and there was no sound in the room. The lights are low. Contrast that with most hospital births, and you already can see how this might lead to dysregulation for the rest of this kid's life, unless we're very, very attuned to what's happening in the ambiance of the birth space. So to not put a baby right on the mother's chest to me seems almost like an act of violence. And that may seem like hyperbole, but we're like, look at our world. Everybody's depressed and anxious and violent. What if we were to change the world by changing birth? I mean, that's one of my big advocacy pieces. So you're finally giving language to so many people, I think, to try to appreciate what the neuroscience actually tells us. Even if we were to look at it strictly materialistically, there's actually quite an abundance of science now to help back us up. And Guys, the science is never settled. This is an evolving thing. If somebody tells you the science is settled, run in the opposite direction. It's not how science works. This is evolving. And I'm glad it is. So, Dr. Mac, did you want to add anything to that? And maybe you can talk a little bit about heart rate variability monitoring, HRV monitoring, because you described the orange, or sorry, the green, the yellow, and the red, which sounds a whole lot like the heart math technologies and whatnot. So I don't know if there's a coincidence there, but Dr. Mac, do you want to add anything or riff on anything there? Hey guys, it's Nathan. Sorry for this brief interruption, but I got to tell you about a new offering that I'm going to be making available this fall. You've heard about the Born Free Method. That's our comprehensive pregnancy and postpartum program. Includes 12 months of weekly calls, 100 plus video modules, tons of citations around pregnancy and postpartum. Well, Born Free is an umbrella under which there's going to be a lot of other courses. And the second course in this anthology is called Clear and Free, Your Solution to Persistent HPV. It's a collaborative effort between me and Mimi Lindquist of the Medicine podcast. She is a relative expert in, I say relative because I don't consider anybody a full expert in anything, but Mimi has gone deep into human papillomavirus and some of the ways that we can use lifestyle to augment the immune system in hopes that your routine screening for HPV or your routine pap smears are going to come up negative and clear, so you can go another 3 to 5 years and not even think about it until your next appointment, whereby hopefully you'll screen negative again. So the typical path that many women experience of all ages in their OBGYN clinic is, hey, you're due for a pap smear and we're going to test for HPV as well. If one of those comes back abnormal, your OBGYN is going to say, oh, darn it, it's abnormal. Why don't you come back for a repeat screening in 6 months or 12 months? And this process continues, right, until you end up with either a progression of abnormal cells in the cervix caught on pap smear or a persistence of human papillomavirus, meaning your body has not been able to integrate the message of this virus, right? Remember, viruses are not living things. So in the meantime, your OBGYN or your midwife or nurse practitioner hasn't given you any tools in order to help support your immune system through diet, through movement, through sleep, through stress management, through hydration, through all of those modifiable lifestyle factors, so that you can be sure that if you had an HPV positive screen initially, that the next time it's going to be negative. Now, the other part of that conversation, of course, is, hey, I got the HPV vaccine. Aren't I safe now? Well, the problem with Gardasil 9, which is the primary vaccine that is offered to young men and women as early as age 9, has not been demonstrated to be either effective at preventing cervical cancer nor safe because of the aluminum adjuvants and everything else. So there's a lot of controversy around HPV and cervical cancer, and even cervical cancer screening methods along with this vaccine. What do I do? Should I get it? Should I not get it? Should my little girls get this vaccine? And so given the sort of swirling pool of information and misinformation out there, I went deep as well. And Mimi and I teamed up in order to clarify for everybody out there the realities around what HPV and cervical cancer screening looks like, what can be done while you're waiting for your follow-ups in order to support your immune system to integrate the message of that virus and avoid any abnormal cells developing, and hopefully avoid painful biopsies, or even worse, LEEP procedures, cold knife comb procedures, and of course, worst case scenarios, cervical cancer. There's so much that's in your power. Your doctors, your practitioners probably aren't maybe educated or incentivized to share all of that information, but we're going to do that through this course, as well as all of the realities around vaccines, especially Gardasil 9. We look at data from the United States and elsewhere in the world. We speak to attorneys who are litigating on this topic around Gardasil 9. What you can expect from the course is around 90 lessons, self-guided. And we're going to also offer monthly calls for 6 months after you enroll with me and Mimi, where we're going to be able to answer all of your questions and provide you with that support that perhaps you aren't getting from the healthcare professionals that you've entrusted your cervical cancer screening and your well woman care. So we get into HPV, we get into cervical cancer screening, we get into the immune system, vaccines, viruses. It's everything you wanted to know about any of those topics. Go to the link in the show notes and you'll find your way to book an enrollment call, and we'll get you enrolled right there. We're going to be enrolling in October. I hope to see you there.
I was just going to say, coming back to what we started, this part of this conversation was that I think a lot of people feel incredibly relieved at two things. So the optimism here is this. One, we do understand the science, and you can build resiliency. Your ability to adapt is something that you can learn and take responsibility for. And so if, in these conversations, that you are spending more time in one platform than the other, then the ability for you to learn some self-regulating practices, and as it relates to your children, or your ability, to, let's say maybe the birth has been incredibly traumatic, your ability to meet that little system to facilitate the myelination and actually, counter any of those negative experiences can happen. And we actually know and have the science of what you could be doing to change that outcome for that child. So, I would say that the optimism is, yes, we understand it. Yes, it's more prevalent, and we actually understand what you can be doing about it. So I would say, that's the place where we meet people, which is, it's not your fault and it's your responsibility. And that's a bigger human, sort of responsibility, isn't it? We are responsible for how we present in the world. And understanding that it's not about the narrative of our childhood. It's not about the narrative of our situation. It's how you're presenting right now as a byproduct of what your experience has been. So I think that that's actually a really important piece for people to understand. And then, you look at, whether it's, like I said, sort of, the muscle tone, your heart rate, how you feel about temperature, how, your ability to connect using eye, it's like we can use all of those things clinically, and we actually have other biomarkers.
Yeah.
So we can look and use, heart rate variability, which is not, for those, viewers that don't totally know what that is. We're not talking about your pulse. We're talking about what happens between your heartbeats, which is controlled by the nervous system. So that's why HRV is such a beautiful biomarker to actually work with the nervous system, because it's essentially the data that's collected between your heartbeats. What's your nervous system doing between those heartbeats?
Right.
Is it calm? Is it not? So it's not just that high heart rate. It's what is your nervous system doing to self-regulate in any given moment, right?
If I can just jump in, Tamara, for people that maybe don't understand what heart rate variability is, literally is the interbeat interval. And it's really very prescriptive in what it should look like. It should be dynamic. And it's largely driven by the communication between your respiratory sinus rhythm, your heart, and your brain. And so you want to see a high degree of variability. This is indicated from decades of science. Actually, it's a widely accepted measure as an overall indication of level of health. Lots of people have biometric wearables now. Like HRV is something that many, the general public is using as an indication of, hey, how's my system regulating? Like the idea of nervous system regulation is not just something that neuroscientists are throwing around. I think many, many people now are starting to look at it, through rings and watches and whatever, to have an indication of how am I doing today? How hard can I push myself? Should I ease up a little bit? And I love that, because it's not all up here. And it just opens the door for these conversations around learning that you can actually become a better regulator, but it requires practice, intention, action, and repetition.
Yeah, let me throw another metric in there that we could consider, which is the function of the immune system, which is really there to keep us safe from a variety of things, including, cancerous cells, persistent human papillomavirus, a lot of things in my community, a lot of these things are very, very important, not to mention, the stuff we've gone through in these past couple years. You know, if we were to, maybe we can just talk a little bit about that. You know, what is the role of the, like when a person is stuck in dorsal vagal, are they predisposed then to some other bad things happening? Because, you know, is their immune system going to respond to this chronic stress? I kind of know the answer, so I'm not trying to feed it to you, but I do want to know, how does, you know, in your research, how does that this sort of tendency for us to be stuck in either flight or fight, or even in the freeze state, how is that impacting our ability to to interact in a world that's out, you know, where viruses outnumber bacteria 10 to 1?
Here's what we know definitively about the different platforms and what happens with the immune system. We know that when you're in a ventral state, that's when your immune system is functioning at its best, unimpeded. You know, when we drop into sympathetic, what is supposed to happen, this is a short-term mobilization where all energy gets diverted basically to the limbs so that you can mobilize and go into fight or flight. In order to do that, energy, you know, we drive up cortisol, we drive up adrenaline, energy gets shifted away from healing platforms. So immune system function becomes lessened. And everything really is directed towards getting away from whatever the threat is. When you drop into dorsal, that gets it's exacerbated even more, because you drop into this state where, and this happens with deep sea divers, where you drop into its basic survival. You can breathe. Pain is severely lessened because you're in an immobilized state. You don't need all these other things going on. You just need to stay alive. So your breath continues, heart rate continues. We see this in like, you know, Poor just went to India to study these deep meditators who their heart rate almost stops, their breathing almost stops. You're barely alive. So this is not a time when immune system function is bolstered. You know, in conventional medicine, there's a lot of isolation between these systems when really this is all working in an integrated way. It's the neuroendocrine immune system functioning together. And so the interrelationship is critical. And in fact, we know that the vagus is a big driver of immune function through these something called the cholinergic anti-inflammatory pathway. And when vagal tone is low, inflammation is high. When vagal tone is high, inflammation is low. This is obviously a function of that interaction between the neuroendocrine immune. So yes, you want to be more green. You want to be dropping into those lower evolutionary states when you need to, when there's a threat present. But when there's not, you want to be in that most healing, elevated place.
Yeah. So of course, if we have a bunch of counseling from our doctors to our 3- and 4-letter organizations, to our politicians, to our friends, our community, like if you want to heal, if you want to stay healthy, it's critical that we're able to connect, that we're able to see one another, that we're able to be vulnerable. And when we have different, you know, barriers to that in place, I think we end up shooting ourselves in the foot in some ways. So on the one hand, I'm not trying to make statements about COVID, but I think it was a beautiful illustration as to how how we're so worried about people getting sick, and yet we're harming them maybe indirectly. You know, it wasn't, maybe not intentional, right? But if you're scaring a person about something infecting them and making them sick, you're kind of putting them at a they're starting a whole lap behind the rest. I don't know how
you're shifting from a state. You're actually they were counterposed, right? The public health mandates on the one hand. Here we know that connection is a biological imperative, and then we have public health mandates that say you need to stay in isolation, you need to not have contact with other human beings. So your nervous system is like, I need connection, and then your nervous system is also like, and there's this threat. So how do we, and so what happened then, everybody gets driven down into sympathetic and even further into dorsal vagal, because our need for connection is actually replaced with the need for protection.
Yeah, I'm trying to be as soft spoken here as I can, but you guys can probably guess just how hard these past couple of years were for me. having friends remove themselves from my life, you know,
Yep.
a lot of clinicians not being able to be with their birthing clients because of some policy at the state or federal level. Like, there's going to be a lot of wounding there to be healed, I think, and a lot of distrust there that needs to be healed over the next couple years. I mean, if not for the rest of our living lives, I don't know. Who knows?
Well, and I generally am curious about all of these children that lost, we just talked about the myelination, and we talked about the first 2 years of life, and to grow into and grow a healthy ventral vagal response in the world required and requires full facial ability to interpret what's happening with people. So as soon as, you've got these, new to the world little souls navigating without what we need and we know we need as humans to cue us to connect. So what happens when you've got, these little ones that were born 2020, 21, 22 that have spent a significant amount of time disabled from their ability to relate to human facial expression?
Yeah, I've no doubt nervous system development has been compromised, and there'll be many PhD theses that will be born from probably what just happened.
Well, and you, Monique, I mean, maybe you can speak to, there was a question that somebody sent you, a chiropractor who had a patient who was a teacher, and they were engaged in this conversation. And the question, correct me if I'm wrong, was, aren't you seeing more sympathetic children right now? Or aren't children's behaviors, worse than they used to be? And your response was really brilliant, because what you had said was, well, you're always going to pay attention to the child that's acting out sympathetically. But but your bigger concern is, what about all the kids that are behaving themselves, that are numbed out, that are in that dorsal vagal?
Yeah.
Right.
Yeah. Dr. Mo, do you want to, riff on that?
Mm-hmm.
Yeah, so I think the squeaky wheel gets the grease, right? This teacher was basically saying, we're learning about polyvagal, and she's like, oh, there's way more sympathetic kids. And I'm like, you're noticing them. You're not going to notice the quiet kid in the corner who's actually at greater risk, right? If you want to be able to at least mobilize a response, if you're so stressed out and compromised that you can't mobilize, then you're in trouble, right? Because you're the furthest away from thriving and healing and growing. You actually can get really stuck in those places. And we see it in adults too, right? Depression, hopelessness, this feeling of isolation. We see it certainly in our chronic illness community, where there's just, you kind of cease existing. And the good news is that as we learn and understand more and more about trauma, we can give people the tools to readjust their regulation, to actually elevate their state of being, and to learn to regulate better. That while it's not a conscious decision to be dysregulated, you do have some control. I think the best thing that we can give our patients as clinicians are the tools and resources to promote healing themselves from the inside out.
Yeah. Yeah. Sorry to have jumped in there, but I was curious, could you maybe share a couple of these exercises? I've used a couple of them myself, and it's a pretty, you could try it right now if you're listening to the basic exercise, for example. Hopefully, if you're driving, it might be hard, but
Yep. In polyvagal, there's something that's called the basic exercise. Breath work is also something that's commonly used. Breath work since the beginning of time has been used to regulate our physiology. Certainly, Nathan, from childbirth, how much do we use breath to help regulate, right? So I'll go ahead and show you the basic exercise. This comes right from Stephen Porges. So this is the basic exercise where essentially you clasp your fingers like this and you put them behind your head. And then the next stage is you don't turn your head, you just turn your eyes. Now, we know that the eyes are directly connected to the brain. And in fact, when you have your hands, if we follow Nathan, you have your hands on the back of your head like that, you can actually feel the muscles in the back of your neck move. So what you do is you hold this position, and then you turn your head to one side, and then you wait until you breathe, till you yawn or sigh. And how do you know the difference between a normal in-breath and a yawn or a sigh? Because that always happens like a second in-breath, where it's like that. Now, all I have to do now is think about this basic exercise and I start to yawn, but you do one side, looking just your eyes, and then you yawn, and then you look to the other side, again, just your eyes until you yawn. For some people trying this for the first time, you might not get a yawn. It might take 2 minutes. It might take even longer. Important to know that you just keep trying. You can do it seated, laying down, standing. You can do it anywhere. And it's
Super
very simple, and it elevates tone because of the position and the breath and all of those things. So we're not obviously not going to get into the anatomy and physiology of it today, but it can actually be measured. This, you can see the shift in heart rate variability.
And for those who are listening, you can go to YouTube and, Dr. Mo just demonstrated it. But if you aren't on the YouTube channel, go there, subscribe, do all this stuff, and you can actually see this live. And of course, if you're inspired by any of this, guys, go to pranafound.org, take the courses. It'll be the best $1,000 that you spend, in 2024. I can assure you of that. Sorry, Dr. Mac, I think you were going to say something.
Yeah, I was just going to say, when you combine something like the basic exercise and you're in a place that feels safe for you, and maybe you combined a little bit of the breaths and the sequencing of breath that we know actually is neuroregulatory. So how long, to take the breath in, to hold it, and then as long as the exhale is longer than the inhale, you combine those two things, and that's training the nervous system. That's nervous system regulation. And I think sometimes there's this idea that it needs more than that. But when, for your nervous system, it's on such a, tender, vulnerable little space that these are things that with practice, you can rely on no matter where you are.
Yeah.
No matter what you're doing, no matter what's happening, you can.
Totally free.
You use your own physiology to actually retrain yourself and bring yourself back into a level of balance and calm.
Yeah.
The other thing that's really important, and this isn't, I'm thinking about your audience, and that is another thing that we know is that if trauma comes in a pre-verbal, now birth in and of itself can be very traumatic, not being laid directly on the mother's skin to skin contact, traumatic. Hospital births, traumatic, just by the very nature of, wow, I've just come out of this yummy, warm space into this, what the hell? What we know is if trauma is pre-verbal, then the reparative exercises also are nonverbal. So these somatic strategies, this operating from the bottom up, it's why talk therapy is handy and it can help shift your thinking, but it's not going to do a lot to get your brain out of a sympathetic state. And in fact, Bessel van der Kolk, he's a medical doctor, psychiatrist, he says that the emotional brain is essentially impotent to talk, the rational brain is essentially impotent to talk the emotional brain out of its reality. And we know this when kids are traumatized before they're verbal, then the strategy for recovery and healing must also be nonverbal. I think it.
The body keeps the score. Do I have the?
That's it. That's Bessel's book.
It's Gabor Mate, Bessel van der Kolk. There's a whole bunch of Mark Willin. I know has a really popular book. That's a really good point, Dr. Mo. Which is interesting because from a medical standpoint, despite all of our degrees and our PubMed and all this stuff that we have access to, the best we sometimes can do when we know that a person has a traumatic, let's say just a birth experience, let alone a traumatic diagnosis, heaven forbid they've been told they have cancer or whatever. The best we can do is we say, let's get you to talk to our social worker. And the best they can do is maybe to say, let's get you to see a psychologist in 6 months. Yeah. And maybe they'll do some talk therapy. Maybe they'll get to meet with somebody like you guys. But this is like, I'm hoping that this kind of becomes our more default way of looking at things. You can't just talk your way out of this. We have to actually.
No, I would say you can't talk your way out of it at all. And in fact, until people start to really accept these principles of embodied neuroscience, which are fully, they're randomized controlled trials now looking at what happens with somatic healing when we go from a bottom-up perspective, right? That we have quicker access to that emotional part of the brain. We actually, when we work somatically through the body and not, verbally through the top down, you actually reduce output of the amygdala, that smoke detector in the brain. You improve function of the insula and the anterior cingulate cortex that are responsible for navigating. It's like helping your brain understand, no, actually, there's not a threat. You improve function of the hippocampus, which is the memory center, right? This is a big problem. People that have PTSD is that they don't know what's, is this happening now? Did it happen before? So we improve all of these functions because we're not trying to convince the prefrontal cortex that, hey, everything is okay, because when you need to be speaking, we need to be speaking to the limbic system. We need to be speaking to the survival centers in the brainstem. That doesn't happen with words. It happens with actions.
I think that's the opportunity, of the last 3 years, is that we recognize that we are not responding to our world in the way that we were pre-2020, and we all sort of have had a different reaction to it. Well, that makes sense because our life experience is what we have depended on to interpret what was happening. And so that is all individual. And I think the opportunity right now is that the neuroscience now is sort of tells us how much more we can be doing outside of what was conventional therapy for blah, blah, blah. It's like, now we know, it's like, okay, well, you can take whatever intervention you choose, and you still have to take responsibility to improve your own outcomes. And part of that is going to be nervous system regulation. It has to be. Right? Yeah.
Well, gosh, I could come up with, I've got like 10 more questions that have come to me since we started here, but I think I want to be respectful of your time. Man, I hope people go to pranafound.org and check you guys out. You've got your applied polyvagal program, you've got your trauma-informed program, and your polyvagal kids. Do you have others there that I'm forgetting? I know those are
there's a couple of other programs there. There's one called Nervous System Balm, which basically is it's a 2-hour workshop where we train people how to calm their nervous system. That's Nervous System Balm. Balm like lip balm, not bomb as in explode.
a funnel
I've also just done another one. It's only an hour. It's called Biohack the Brain. And essentially it's for people who are experiencing a lot of anxiety. Biohackthebrain.com, and people can learn some very simple strategies to calm their mind and their body. Here's the thing. I think the best thing you can ever give somebody is to empower them with tools to create the change themselves. These are tools that you can take away for a lifetime. It's not something that you do once, though. Like, I think we need to understand that, this is a constant. As long as you're alive, you can be feeding input back to your nervous system. And what a beautiful thing that you can do that yourself, that you can heal yourself, that you can regulate yourself.
Yeah. It's not a matter of shame and blame. I think people are so stuck in this victim mentality. Like, this is empowering. This is an opportunity for you to take some control when you've outsourced everything, maybe your whole life. Right now, just start doing these little practices and then follow up with you guys. Dr. Mo and Dr. MacIntyre are Dr. Mac, sorry. They're available on Instagram. You can find them at pranafound.org. And you guys have a brand new platform. Do you guys want to, Dr. Mac, do you want to start talking about that a little bit? And then we can wrap it up. Unless you guys have
I'd
more.
love to share. I'd love to share. In keeping with today's conversation, there's a lot of people that need a lot more from their care providers. And so there is a level of, not everybody can head to Costa Rica for a retreat. And those that are chronically ill, a lot of their money is being spent in trying to seek out care. And so what we've created is an online platform to teach people mindful and embodied practices that we know improve resilience. And so it's, we've collected thought leaders, we've, authors and content contributors who have and really curated an opportunity for people from their own home with chronic illness, or maybe somebody that's been given a life-changing diagnosis, to have a place to go to continue their own healing and improve their outcomes, because we know when people can adapt and they're more resilient, they heal. And the reality is that the chronic illness, the number of people suffering with chronic illness just continually, incrementally is growing. We know that the population is changing, that we will have more people over the age of 65 than under the age of 18 by 2025. And so our new platform is really about making these things accessible to everyone, and specifically those with chronic illness at a really affordable rate so that it really is about making it accessible to everybody.
Yeah. In fact, if you go to letscope.org, you can get a 21 days free membership. Everybody, that's available to everyone. And really we created it. Our sole purpose is to ease the path for those who are struggling with chronic illness or a life changing diagnosis. Please
Amazing.
check it out.
Yeah, please. I am not bringing you guys on because I want to get like a 20% commission on whatever sale. Like, I have no affiliation on intentionally, because I want people to realize just how important this work is. Go to letscope.org, guys. These are some of the, and at pranafound.org is where I've taken 3 of your programs. I guess I got to, ante up here and take the others, but I can't recommend it enough. It is really a great sort of reimagining of the foundational things that I think many of us practitioners have taken for granted. I mean, many of us fathers, partners, I mean, we could apply everything here to our real personal relationships. Like, if your partners, you guys aren't fighting anymore and you're in separate rooms, sleeping in different rooms, maybe you're both stuck in this freeze space and you don't know how to reconnect. You got to feel safe with one another. You got to feel vulnerable with one another in order for that connection to take place. So this is through and through. This is like human stuff. This is human work. So I am very, very happy that you guys were able to spend some time with me today. We will send everybody your way, and I just thank you, and I love your work. Thank you.
Thanks, Nathan. It's a real pleasure.
Yeah, thank you so much.
You're so welcome. I'll let you know when this episode goes live. In the meantime, guys, pranafound.org, letscope.org, and maybe we'll have to do a part 2 here in the near future.
Of course.